Welcome back, everybody. Dr. Chris here. Sorry for the absence. I know we've kind of missed a couple weeks in our upload schedule. Things have been crazy here in Buffalo. First of all, you guys have only really seen us working at our outpatient lab. We actually cover 5 other hospital sites. So there's a whole part of our practice that you guys don't see. Today, Dr. John is covering one of our hospital sites and he is doing a TIPS. We've actually gotten permission to film. So we're gonna bring you, for the first time, into the hospital. Interventional radiology is doing minimally invasive surgeries using image guidance.
We do several procedures through small incisions. We keep patients out of the hospital and get them home as quickly as possible.
So before we get into it, I want to explain to you what a TIPS is with the aid of some diagrams. Disclaimer, I'm not an artist. Let's go. Transjugular, intrahepatic, portosystemic, shunt. We're gonna draw a crude diagram of a body. The liver, jugular vein here. The blood supply to the liver comes from the hepatic arteries, which are not shown, but the dominant supply to the liver is through the portal veins. This is a bad drawing, but bear with me here. So the problem with our patient is that the liver is cirrhotic, meaning it's scarred down and the blood doesn't pass through it as easily. Normally the blood goes this direction from the bowel, from the spleen, and then goes through the liver and then drains into the hepatic veins, goes to the heart and gets pumped around the body. So when the blood flow gets backed up, the pressure in the portal veins increases. The fluid can actually leak out of the veins and can accumulate in the abdominal cavity here, and the patient gets what's called ascites. They're requiring us to go in and stick a needle through the abdominal wall, drain off all this fluid, and that has to happen every week. In order to fix the problem, what we want to do is create a bypass channel that bypasses the liver. And that's called a TIPS, or a transjugular intrahepatic portosystemic shunt. The transjugular portion means we're going to enter the body through the jugular vein. Once we have access, we'll put a wire down and we'll go into the right hepatic vein here. We'll then be able to poke through with a long needle and enter the right portal vein. Once we get our wire down, we'll then inject some contrast and we'll see that there's probably going to be some varices here or dilated varicose veins, and those can actually cause bleeding complications. So what we'll do is we'll actually use a catheter to select into those and we'll coil them off with some metallic coils that will block off the blood supply to them and prevent the patient from being at risk for bleeding. While we're down here with this wire across, we'll then place a self-expanding stent, which is basically like a metal scaffolding. And that metal scaffolding will open up and create a false channel between the right portal vein and the right hepatic vein, effectively bypassing liver and relieving the back pressure that's causing the fluid to build up. Okay, you guys are now pros on TIPS, so we're gonna go pass it over to Dr. John, who's at Gates Vascular Institute.
John, come here.
What?
Come here.
No, I don't want to be in there.
Celia works with us here at Gates Vascular Institute. She's one of the very talented cath lab techs.
Thank you.
Come on over to Matt right there. That's Matt. He's also a very talented cath lab tech. We don't know this guy.
John, where are you going?
You're on the
Get
vlog
back
now.
here. You're on the
hell if
vlog.
I
It's
don't
too
change
late.
my ways. So we're at the Gates Vascular Institute today. We have a very interesting case. We're doing a transjugular intrahepatic portosystemic shunt, which is a shunt in the liver for patients with chronic liver disease. We're excited to be here today. We're using the AccuNav ICE IVUS probe, and we're very lucky to have our reps here with us.
Hi, I'm Robert.
They know the specs a little bit better than I do. Becky, we did the IVUS case back at PCL, so we have an IVUS there for intravascular ultrasound, and the reason why this is different is the Volcano IVUS gives you a 360 view of what you're looking at, whereas this gives you a linear view or a side shot view of what we're trying to do. Hey Robert, are you from New York City? I feel like that accent.
From Gulf Shores, Alabama.
Gulf Shores, which I've actually been there. Where are you from originally?
From St. Louis.
St. Louis, that's right,
Yep.
you told me that. Okay.
Yep.
You can actually do the TIPS cases without the AccuNav IVUS, but what they found is that using the IVUS can actually shorten fluoro times and make the procedure hopefully a little bit safer. So we're gonna trial it today, and hopefully it's gonna become a mainstay of our procedures. And then Dr. Nicholas is gonna use it next week. Do you know him, Becky?
I might have met him once or twice.
So he's gonna do a case this week, or pardon me, next week with the AccuNav IVUS.
So change of plans. I came over and John and I are going to tag team this TIPS. We're basically going to get IJ access into the jugular vein. We're going to go down into the liver and create a shunt. We're also going to use IVUS, or intravascular ultrasound, to help with the puncture. Essentially what that is, it's a type of ultrasound, but it's been miniaturized and the technology is put on the edge of a catheter. We've actually used it before for some of our vein cases, link up here. But yeah, we're gonna use this to help us with the puncture in the liver to get to the portal system and to place our stent. So let's go. So wire access is down through the heart, and we're down in the IVC, which is next to the liver. And place our sheath. We've got a sheath access down. We're gonna put another access point next to it. We're gonna put another sheath in. That's gonna be for our IVUS catheter so we can see inside with ultrasound. So we're just measuring the blood pressure in the right atrium of the heart to make sure the patient's not right heart failure, because if we do it tips in that case and the pressures are too high, we could actually make their heart failure worse. This is the IVUS catheter putting in the intravascular ultrasound, so you can see really nicely the anatomy, all the blood vessels, and all our targets. This is a long needle that goes through this long sheath set here. That's how we access, we puncture through the hepatic vein wall, through the liver, and into the portal vein wall. That's how we gain access. Found a few varices. These are high propensity for bleeding, causing gastrointestinal bleeding. So what we're doing is we've selected into them and we're coiling them off to prevent bleeding. Okay, so we have to measure how long our stent graft's going to be. We use this pigtail catheter that has centimeter markings on it, kind of like a ruler. We've dilated the tract with a couple balloons. We're going to put the sheath across the tract that we dilated, put the stent through the sheath, and then unsheath it. Stent graft is deployed. Just going to balloon the tract again. We are all finished. Stents in place. So we pulled everything out, just holding pressure at the neck to stop bleeding. There's an age-old saying in IR that he or she who punctures shall hold. Dr. John's the one who punctured, so I think that he should be holding pressure at the neck. And we'll get our anesthesia friends to wake our patient back up shortly. This is our first procedure on the vlog with anesthesia. It's the first procedure on the vlog not in an outpatient facility too. All right, another long day. What time is it now? Like 7:30? Well, this isn't even an on-call case. This is just like
No, it's just a long day.
First time you guys have seen us outside of our outpatient lab. What do you guys think? Let us know in the comments below. Would you want to see more hospital type stuff? It's a lot of different cases that we do here. And they might kind of think that a lot of the stuff we don't do is very serious. You don't see the other 5 sites we cover outside of Park Club Lane, which are all hospitals.
And it's all really serious. I thought it was a really great experience to be able to show our subscribers what it's like working at the Gates Vascular Institute, which is really an impressive place, and we always really enjoy coming here because the collaboration with other specialties and technology is so advanced here, and the staff is phenomenal and the administration here is phenomenal. So it was really a great day and really a privilege to be able to work here. So
if you like the video, subscribe, get a thumbs up, do all that stuff. And I'm Dr. Chris.
And I'm Dr. John.
And we'll see you on the next one.